Hello, this is likely going to be a small group, but we are recording it so that we can share it online. We'll get started in about 3 minutes to allow some time for anybody else to join us.
I'm gonna be
So hello, I'm going to go ahead and get started. My name is Adele Struble. I am the project implementation partner of the Thriving Providers Project here in Philadelphia. And today you're joining us for the application information session of the Thriving Providers Project. Today we're going to go over just a project overview, what your experience should be like as a participant of the Thriving Providers Project, what the eligibility criteria is, any potential public benefits impact, what the timeline of this project is, and how to apply. And if time allows, then we'll answer some questions at the end. It should be about 30 minutes that we'll be spending time together this afternoon. So the Thriving Providers Project is a national initiative spearheaded by Homegrown to support local direct cash pilots to stabilize the economic well-being of home-based childcare providers so that children can succeed. We know that most young children, especially infants and toddlers, are cared for in home-based childcare. It amounts to 5.4 million children being cared for in home-based care. We know that families prefer home-based childcare because of trust, cultural similarities, and language opportunities. Often family childcare homes are located in the communities that families reside in. And family childcare homes work traditional and non-traditional hours, which oftentimes work better for the families being served. We know that the current child care payment mechanisms, both public and private, are unstable, sporadic, and insufficient. Payments and reimbursement rates are primarily based on settings, age of children, the number of children served, times a day of service, and hours of service, rather than the value and quality of services being provided. The early childhood field has developed numerous quality models and built amazing facilities, but they've struggled to address the caregiver compensation component. This project seeks to address the compensation and economic stability as a foundational step in building effective programs and quality experiences for children and families. This initiative seeks to demonstrate the impact that direct cash payments can have in reforming the reform child care payment policies and influence future decisions around compensation for home-based child care providers. I wanted to share with you about who are these organizations that are involved. So the Thriving Providers Project is the national initiative that we're working with and offering here in Philadelphia. Homegrown is a national collaborative committed to improving the quality and access of home-based childcare. Homegrown is the parent organization of the Thriving Providers Project. And PHMC is Public Health Management Corporation, and we are located in Philadelphia and this region, and we are the local implementation partner of the Thriving Providers Project in Philadelphia. Thriving Providers Project is a national initiative, though, so there are projects being currently run in Colorado. They've already run through 2 cohorts, and there's a third one one has been completed, a second one is currently running, and a third one is scheduled to start in January. In King County, Washington, the Thriving Providers Project is a learning partner. Thriving Providers facilitates conversations to offer support in determining Family, Friends, and Neighbors subsidy and wage boost programs. And in New York, All Our Kin is in their planning phase to launch a cohort of family child care providers, and they hope to launch later this spring. And in Philadelphia, we are launching the Thriving Providers Project for family child care providers, licensed family child care providers in Philadelphia. We will be serving 45 family child care homes, and we are launching, the application launches today, and we're very excited about it. So the Thriving Providers Project will provide $250 every 2 weeks for a total of $500 a month over the course of 18 months of direct cash. Direct cash payments are designed to support family child care providers to help meet your needs and can be spent however you choose. As a participant of the Thriving Providers Project, you can expect to be valued. Some examples of this that I'll give is just, if we say we're hosting a 30-minute meeting, we're hosting a 30-minute meeting. I'm going to shoot very hard to make sure it only lasts for 30 minutes because your time is valuable and we value your time. We also value you as the caregiver and your experience. So we want to hear your voice and we want to learn from you and learn by doing. So if something isn't working, we want to hear that feedback so that we can make adjustments to make sure that it is working for you. The Thriving Providers Project is an open source, so information is freely exchanged. One example of this will be that there is an evaluation component of the project that's being run through Stanford. Stanford is going to be sharing information with you. It's not just like capturing all the information and storing it and then reporting it out after the end of 18 months. There is going to be an open dialogue occurring so that, because it's an open source project. We are using and leveraging guaranteed income best practices. Those best practices really want to iterate that you are the expert and you are trusted in this project. That is part of the reason why these are unrestricted dollars. We are not going to determine for you how you can spend your money. So those are part of the best practices of guaranteed income projects. We are working really hard to mitigate any unintended negative consequences. And when I say that, we're going to have a whole description of what, like just one of those aspects, but we don't know what offering $500 a month for family child care providers, what negative consequences there maybe could be. And we don't have a magic 8 ball to see like, oh, what does the future hold? But what we are doing is putting everything in place that we can potentially forecast and mitigate any unintended consequences. And we have a commitment to equity. That's part of the backbone of the Thriving Providers Project, is that this is an equitable project. And we value you as the family child care provider. So as your experience, what you could expect as part of this experience is not just $500 a month for 18 months. You can expect, well, what we expect of you is that if your situation changes, like the requirement is that you're a licensed family child care provider in the city of Philadelphia, and we expect from you to advise us if your situation changes. There is a verification upon your application of your information that you're providing, and a re-verification at midpoint. And then what we offer is that if you desire, you can also participate in our Cash Plus activities. Those activities will be community opportunities that you'll be invited to participate in. There's no requirement that you participate in it. You will just be aware of those activities. And if you desire, we will ask and offer that you can participate in different teams. There's the policy team, and we also will listen to your story and maybe record your story so that we can then share out about what your story has been as you participate through this experience. The Thriving Providers Project, though, is offering unrestricted direct cash payment, and that is one of the core values of this project. So there's no true requirements that you participate in Cash Plus activities or that you volunteer to participate on a team. There's no requirement of that, but we will ask you and offer that experience for you. As part of the Thriving Providers Project, there is a significant research component. And the research and evaluation is important because it helps us measure and analyze the impact that Thriving Providers is having on family child care providers. It'll allow us to tell your story, your human story as a provider, and shine light on your experience. It'll help us learn from your experience as to what's happening in the real time so we can make changes and improve the program. Instead of just saying, this is the pilot, this is how it is, let's run it for 18 months and see how it goes. We want to learn in the moment and make those changes and make it better so that we can really identify true solutions. And through your story and through the measurement of the evaluation, it'll help us potentially secure funding for programs like Thriving Providers Project in the future. For example, state funding or local funding or federal funding. But without the evaluation component, we don't know what's working and what's working well for whom or how. So that is why the evaluation component is such a significant component of the Thriving Providers Project. So if selected to participate in the Thriving Providers Project, you'll be offered the opportunity to enroll in the evaluation process, which is being led through our Stanford team. And just to reiterate, the evaluation process is going to be utilized to help us secure funding in the future for similar programs like Thriving Providers Project or for Thriving Providers Project in the future. So that is the mission of the evaluation component. The evaluation will be asking you to complete one survey a month. That survey will take between 5 and 15 minutes. You will receive a link to that survey via text message or via email based on however you choose. Those surveys are in English and Spanish, and they can also be completed over the phone if you would rather do that instead of completing it online. For every survey that you complete, you'll receive $10 digital gift card. And then for every 3 surveys that you complete, you receive an additional $20 bonus. So those are those incentives to participate in the evaluation component. So moving on to the eligibility component. This program is for licensed family child care providers in Philadelphia, working a minimum of 20 hours a week, and that you care for at least one child under the age of 5. There's priority consideration being given though, so that based on the needs of the community. So we're looking to our priority consideration will go towards providers, family child care providers that are star 1 and star 2 in the Keystone Stars quality rating system. Those that are serving subsidized families, and through the use of the reinvestment funds evaluation from 2023, those that are operating in areas of high poverty and areas with a total shortage in childcare supply. And I'm happy to share that report with you as to what those specifics are and where those areas are across our city. We will be using then an eligibility rubric to rank providers based on